Interpreter Appreciation Day. So I want to thank all sign language interpreters, to include Gail Coronado, who is with us today. The hard work that they do to facilitate the communication of important information to Louisianans who are part of the deaf or hard of hearing community is extremely important, and I want to thank you for your service. Before I get to the COVID update, I did want to note that I'll be happy tomorrow to welcome President Biden back to Louisiana. He will be visiting Lake Charles and then New Orleans to discuss his infrastructure plan. And personally, I can't think of a better place to do that. And it is incredibly important that we invest in infrastructure here in Louisiana and around the country. I'll be joining the President in Lake Charles tomorrow at the bridge. And again, this is fitting. Infrastructure in Louisiana, roads and bridges, have been given a D+ grade. Louisiana has 1,634 bridges in poor condition. Later that day, he will tour water and sewer infrastructure in New Orleans, and he will see firsthand the struggles that we face, as more than 50% of our water systems have infrastructure that is at least 50 years old. It's also critically important for the President to visit Lake Charles, because we are still rebuilding from Hurricanes Laura and Delta, and much assistance is required, and that assistance really can only come from the federal government. The storms were last year, but we are still fighting for our communities and our families so that they can fully recover, and that additional federal support, especially in terms of a disaster appropriation for the permanent housing and resiliency that we need to be engaged in Southwest Louisiana, is incredibly important. I will also be thanking him for Louisiana's funding from the American Rescue Plan. As you may remember, last week on Thursday, I announced our plan for the use of those dollars, and it's very heavy on infrastructure. So that will, I think, tie in very well with his visit as well. Another priority that we announced is jump-starting tourism again in the travel industry, which, as we all know, took a huge hit last year because of the pandemic. I've declared this week Travel and Tourism Week in Louisiana to bring attention to this vital industry in our state. I think we have a once-in-a-lifetime opportunity to take this substantial funding, $3.2 billion in total for the state, $2 billion for local government, and put it to good transformative use. And you really can't do that if you divide it up dozens of different ways, because you're not going to have enough of an investment in any one area to have that transformative impact that we're all looking for. And so I think the plan that we laid out is a very smart use of one-time funds. That plan was developed after consulting with people all across Louisiana, in every nook and cranny of our state, talking to the state agencies who oversee efforts related to water, to sewer, to infrastructure, and so forth. And I look forward to sharing these priorities with the President during his visit. And now we'll get to COVID. Today we're reporting 459 cases on 17,686 new tests. Very sadly, we're also reporting more deaths. 13 more deaths today. The total now is 10,418 since the start of the pandemic. We currently have 338 COVID-19 patients in the hospital. That is an increase of 21 from yesterday. 33 of those patients are on mechanical ventilators, and that is a decrease of 5 from yesterday. Right at 27% of all Louisianans are fully vaccinated today, and 32.4% have at least one shot. 35% of all adult Louisianans are fully vaccinated, and 42% have at least one shot. Louisianans 65 or older, 68.5% of them are fully vaccinated, and that's a good number. but that means 31.5% are not. And so we've got to continue to work, not just on the older Louisianans, but on all Louisianans, because we need people to be vaccinated in larger numbers and quickly. But it's really important that not only that everyone get vaccinated, but those more vulnerable because of their age or health condition to COVID-19 are vaccinated. Because when we do that, we can be reasonably sure that we won't have the run on the hospitals that we had in the past when we had surges. And remind you again, we had well over 2,000 in the hospital at one time early in 2021. But we also won't have as many deaths because the way this works is you get positive one day, you get sick a few days later, you go in the hospital after that, and then you die after that. And so you have lagging indicators. But at the end of the day, if you want to get to a zero death count, you got to have a positive impact on the front side of all of that. We can do that now through vaccinations, as well as continuing to slow the transmission of the virus. So it is extremely important that everyone get the vaccine, including younger people, because young people, by the way, often get sick, but even if they don't, they become contagious and they can continue to spread the virus to other people who will, in fact, get sick and be one of the ones who end up in the hospital or worse. I can tell you that I'm very excited about the fact that on Mother's Day, this coming Sunday, I will be able to personally visit with my mother inside, without distancing, without masks, because she and I are fully vaccinated. And so that Mother's Day celebration will look like Mother's Days of the past and not Mother's Day of 2020. That's something that's available to all of us, and we can do it safely. I'll know I'm not giving her the virus. She'll know she's not giving it to me, and we can relax and have a Mother's Day like we all should desire. And so I encourage people, not just because of Mother's Day, but for any opportunity that you might have to get together with individuals and celebrate, please get your vaccination. The sooner, the better. We have 3 safe and effective vaccines, and they are available at more than 1,500 locations in Louisiana today. If you need to find a provider for a shot, if you want to ask a question to a medical professional about the vaccine, please call our hotline at 1-855-453-0774. Again, that hotline is available to schedule appointments, to find a provider, or to ask questions of a medical professional if you have questions. We want you to be confident about the vaccine. We know and believe that they are all safe and effective. We want you to feel that way as well. So please call that number, 1-855-453-0774. The federal government has also launched several useful tools for finding a provider. One way is to text your zip code to GetVax, G-E-T-V-A-X, and that number is 438-829. Again, text your zip code to 438-829, and it will send you a list of providers in your immediate area. The list can also be found on vaccines.gov. I do want to make you aware of some new operating hours for the community vaccination site in Baton Rouge. Starting this Sunday, Mother's Day, May the 9th, they will be closed on Sunday and Monday and open 10 a.m. to 6 p.m. Tuesday through Saturday. There's also a vaccine pop-up at the Mall of Louisiana in the former Williams-Sonoma store on the first floor. It opened yesterday, and it'll be open tomorrow as well, today and tomorrow, from 11 a.m. to 7 p.m. And then on Friday and Saturday, May the 7th and May the 8th, it'll be open from 11 a.m. to 8 p.m. I'm also excited to announce that today we're launching a feature on LA Wallet that will allow you to access your COVID-19 vaccination record if you choose to do so. LA Wallet is Louisiana's digital license app, and it is optional and free. and easy to use. And I've enjoyed seeing how excited people get about receiving their COVID vaccine card, but inevitably, some of us are going to lose them and need to replace them. In fact, that's already happened. And many people just prefer having the option of a digital record. Again, this enhancement to LA Wallet is free. It's a secure way to access your own personal health information. And if someone wants to have a digital copy of their vaccination record, they should be able to do that easily and at no cost, which is what this optional feature at LA Wallet allows. So if you don't already have LA Wallet, you can download it through the Apple Store or Google Play. At this time, I'm going to turn things over to Dr. Cantor for his updates. There are some exciting developments that we believe are coming in terms of younger people being eligible for the COVID vaccine. I believe it's going to be the Pfizer variety. He'll speak more about this, but I will tell you that we do expect to have this vaccine available to people with FDA and CDC approval in the near future. So with that, I'll give it up to Joe Cantor, and I'll come back in just a moment.
Good afternoon. Thank you, Governor. Thank you for your leadership, and thank you for your service as well. I also wanted to mention, in addition to Interpreter Recognition Week, it's also Public Service Recognition Week, and we have a lot of really devoted public servants in Louisiana that, particularly throughout COVID, have just been pulling way above their pay grade. So I wanted to give them recognition and let them know on behalf of myself and Secretary Phillips and the Department of Health, for all agencies that have been working during this public health crisis, that we really do appreciate what you do. And thank you for that. Our COVID numbers in terms of epi numbers continue to be relatively reassuring, and I'll run through some stats right now. As of today, percent positivity of all tests conducted on the state is down from 2.8 to 2.7%. 6 out of 9 regions in the state have had decreases in percent positivity. The remaining 3 have had very small increases. We are now, compared to all 50 states, the 9th lowest in terms of new cases day by day, the 9th lowest in terms of percent positivity, and the 5th lowest in terms of hospitalizations of COVID patients per capita. All of those numbers, I think, are reassuring. We got here by doing the right thing. So let's keep it up. It's important to recognize that mandate or not mandate the public health recommendation for distancing, and particularly masking, and particularly when you're in settings with unvaccinated individuals indoors, is very much still there. The recommendation is very much still there. At this point, 14 odd months into this pandemic, we have a good sense of what is effective in keeping us safe. And for individuals, particularly unvaccinated in indoor settings, masking and distancing are highly effective. So I do want to encourage people, even though our numbers are encouraging at the moment, there is no guarantee that they stay that way. And I want to encourage people, first and foremost, to get vaccinated. Secondly, if they've not yet gotten vaccinated, those recommendations of masking and distancing really do apply to you. They can keep you safe. They can keep your family safe as well. The variants continue to give me concern. They continue to add urgency to the vaccine campaign. And every day that goes by is, each time the virus transmits from one person to another, there are small mutations that take place. That's a normal element of viral transmission. And 99.9% of the time, those mutations are insignificant and irrelevant. Every now and then, a mutation arises that is not irrelevant, and it leads to a variant of concern. The first and foremost way to reduce the chance of any variants of concerns in the future are to reduce transmission now, which can happen through masking, distancing, and even better than that is vaccination. We've been very fortunate that the variants of concern circulating now remain good matches for the vaccine. There is no guarantee that that maintains that way in the future. So we have this window of opportunity now that we really do need to capitalize on that. Similar to last week, of all COVID circulating in Louisiana, CDC is pinning 33.3% of all that COVID as the UK or the B.1.1.7 variant. That's a number that's been steady for the past 2 or 3 weeks now. As we announced a little bit earlier, we now do have the P1 or Brazilian variant identified in Louisiana. We now have a total of 7 cases of the P1 variant. Of course, this is a tip of the iceberg scenario where we still, as a country, do relatively little genomic sequencing of these viral samples. So when you have 7 identified cases, you certainly have more that you just haven't identified. Those 7 cases come from regions 1, 2, 5, and 6. That's the New Orleans region, the Baton Rouge region, the Lake Charles region, and central Louisiana. As a whole, across the country, 3.5% of all COVID circulating is the P1 or the Brazilian variant. We continue to have no identified cases of the B.1.351 or the South African variant. The governor mentioned top-line numbers for people vaccinated in Louisiana. It continues to be encouraging, yet we know we have a lot of work to do right now. There's been 2.7 million doses of vaccine administered in Louisiana. As the governor said, 32.4% of our population has now initiated the series, and 1.25 million, or about 27%, have completed that series, and encouragingly, just below 69% of those aged 65 and above are now fully vaccinated. And you can see that in those nursing home death numbers that we've shown previously, and certainly in our hospitalization numbers, which have been below 500 for a good few weeks now. All of that is encouraging. I want to let folks know that we have added some ethnicity demographic information to the vaccine, the LDH vaccine dashboard now. You can now go in and see progress on people who self-identify as Latinx or Hispanic. That's added to the racial demographic information that's on the dashboard. So right now, of all vaccines administered in the state, 3.9% have gone to individuals in Louisiana who self-identify as Hispanic. Just to put that in perspective, as a population base, 5.3% of Louisiana identifies as Hispanic. So if you did back of the envelope math on that, we're at that 3.9% is 74% of predicted, what the population would predict, which I think is encouraging progress, particularly that it's a marginalized community here, but clearly we have work to do. The data completion on that is 69%. We have ethnicity data on 69% of every vaccine that's been administered. To compare that to national numbers, which I'd like to do, we're ahead of the curve on this. So nationally, and this is according to the CDC, 12.3% of all vaccine administrations have gone to individuals who identify as Hispanic, and that group represents 18.5% of the U.S. population. So the U.S. is running 66% of predicted, a little bit less than Louisiana is. Even more notable is the data in Louisiana is much more complete than national data. Nationally, the CDC only has information on 55% of vaccine administrations. Again, we in Louisiana have data on ethnicity data on 69%. And I'll tell you, that really is as a result of the hard work of the public servants that I kind of gave nod to earlier on. So we have decent quality data, and I'm encouraged by the progress we've made in the Hispanic community. I know we have more work to do there. I do want to mention a new feature that's available on our Louisiana vaccine hotline, and that is the ability to bring vaccine to individuals who are homebound. This is an important service. Just because someone suffers with a disability or for other reasons is homebound, they certainly should be allowed to avail themselves of the protection of the vaccine, and that's what this service does. So the hotline number, which we've said before, and I'll say it again, is 855-453-0774. It's open till 8 p.m., 7 days a week. If you are homebound, if you care for someone who is homebound, you can call that number. We can take down your information and link you with a team that can come on site to your house and provide that vaccination. That's an important service. We've now had over 3,000 people call that hotline, and just over 1,100 have been connected with vaccine appointments. So it's still a valuable service to get information about the vaccine, to get connected with a medical professional. if you have more granular questions, to actually have an appointment made for you at a vaccination site in your neighborhood. And now, if you're homebound or you care for someone who's homebound, we can actually bring vaccine to you. And we're very proud to offer that service. Looking forward, I do want to let folks know what our vaccine allotments are going to be, and I'll talk a little bit about a change in how the federal government is going to run vaccine allotments across the country. So for the current week that we're in now, we are allotted a total of 130,130 doses of vaccine. That breaks down to 69,030 Pfizer, 50,700 Moderna, and 10,400 Johnson & Johnson. For next week, we will be allotted 127,730 doses. That breaks down as the same 69,030 doses of Pfizer. I should say these are all first doses, that usually a second dose follow. An increase of Moderna to 51,900 and 8,000 Johnson & Johnson doses. What the federal government announced earlier this week is in response to requests from a number of states, they are going to make available to other states with higher demand any excess vaccine that is not ordered by a current state. The entire allotment will remain available to each state. Anything that's left after that unordered will essentially go into a pod and be distributed to other states that are seeing increased volume of vaccinations right now. By us, this sounds like a good plan, because if doses shouldn't be sitting on a shelf, they should go to use somewhere, and in the end, I think that serves everyone's interests. So for the past 3 weeks, we've not needed to order the entire allotment that has been available to us. There is enough vaccine for everyone in Louisiana that might want one. There is enough second doses on hand for anyone that needs it. This is truly just excess vaccine doses. And I'll tell you, cumulatively, Louisiana has ordered 81.8% of all vaccine doses made available to us by the feds. Of that, 99.7% has actually been delivered and in state. And of that, 73% of those doses have been administered into people's arms. Some other announcements that have come from the federal government this past week, they're encouraging walk-ins in retail pharmacies offering vaccines. So prior to this, it was a real focus on asking people to make an appointment. And what the federal administration is going to be doing, particularly to the large retail pharmacy chains, of which we have a number which in Louisiana, Walgreens, CVS, Walmart, Kroger, Berkshire's, for example, people will be encouraged, if they would like to walk in as a convenience factor, and that's encouraging. Also, as the governor mentioned, there's a federal text hotline to get information on vaccine sites near you sent to you. And the governor said it, I'll say it one more time. If you text your zip code to GetVax, and that spells out as 438829, you will get spit back as a text message a list of vaccine providers in your zip code. It's a handy feature, a quick way to get some vaccine sites near you. The federal government also has a new vaccine finder site. It's at vaccines.gov, and it provides a very similar service. You could put in your zip code or your address, and it'll show you all the vaccine sites and who has inventory on hand near you. So all of those should make it a little bit more convenient for people to find out where they can get vaccine close to home. I'm very excited to learn that we have every expectation now that in the coming week, the FDA is going to likely amend their emergency use authorization of the Pfizer vaccine and extend it down to individuals 12 years of age and above. This is an exciting development. Pfizer had submitted data a few weeks ago for that age group, the 12 through 15-year-old age group, and the data they submitted was really encouraging. And of course, that's not all the data that's out there, and as both the FDA and the CDC meet next week, there'll be more data released, and we're looking forward to reviewing that data closely. But if it tracks along with what's already publicly available, it's very, very encouraging. The data shows high efficacy and great safety in the age groups of 12 to 15 with the Pfizer vaccine. So we do expect the FDA to make a decision on this early next week, And then we believe the CDC's Advisory Committee on Immunization Practices will meet a week from today, on Wednesday the 12th, to review and make further recommendations. What I would encourage people now is, if you have a child who's between the ages of 12 and 15, talk to your pediatrician now. Don't wait for this to come out next week. Be thinking about it, be talking to your pediatrician, get your questions answered. I think people have reasonable questions, very reasonable questions, and there's very reasonable evidence-based answers out there. Take your time now. If you have an adolescent or someone between the age of 12 and 15 in your house, see your pediatrician, talk to your pediatrician, get your questions answered. Put yourself in a position where once this authorization does come through, you're able to avail yourself very quickly of it. On one hand, we know that people that young tend to do well clinically if and when they get COVID, although that's not absolute. And there are some long-term effects we're seeing, but usually they do well. We also know that these vaccines, just as the governor said, prevent the chance that you're going to spread COVID to someone else. So by getting younger individuals vaccinated, it's an opportunity to protect everyone in that household. And that's really, really exciting. On that note, as the governor mentioned, I think we're all looking forward to a more normal Mother's Day this Sunday. I certainly am myself as well. I will say the number one thing you can do to make that a safer environment is to encourage everyone who's eligible in your household or who will be coming over to get vaccinated. Simple as that. Best thing you can do to protect your mom is to get everyone who's going to be with her vaccinated. And if there will be people who are unvaccinated in your Mother's Day gatherings, I do advise you continue to follow the precautions, be outdoors as much as possible. And if you can't do that, it's probably best to remain masked. Again, it's not worth putting someone at risk, even on a holiday like Mother's Day. I'd be happy to answer any questions. Yep.
So if the FDA, CDC approved Pfizer vaccine for rolling up early next week, when can we expect the state to allow that service to go? Immediately?
Likely very quickly. We would like to have a chance to review the data. Usually that data comes out ahead of the actual decision because the committees use it to meet. So we'll be reviewing that data once it comes out. And again, if it matches with what is publicly out there, which is encouraging, you can expect to see LDH match that recommendation very quickly. Yes, sir.
I understand last month there were a lot of pilot programs in reaching hard-to-reach communities for vaccinations. Now that those are sort of passed, what's sort of the next phase in that outreach effort? And is there anything that you've learned or that was really successful in that?
It's very much the same. And there's a retooling process to expand that work that's happening. And it's interesting because President Biden alluded to this in his remarks last night, and he directed FEMA to start thinking about how they move some resources from these larger events into more targeted community-based interventions. And that's been the plan, so to say, for a few weeks now in Louisiana. You know, we're in this phase of vaccination now where, you know, most people who were very, very self-motivated have likely already gotten vaccinated if they're eligible. And now there's a large segment in the middle. Some people term them the movable middle, but there's a lot of people in the middle right now who are not adamantly opposed to getting vaccinated. They just haven't done it yet. They either have questions, or they're not sure, or they're still waiting and seeing, or there's some other barrier. We need to address it, make it more convenient. We believe that the more targeted interventions that we can help orchestrate and partner with community organizations on, the more we're going to be able to reach those individuals and make them feel comfortable. The novel thing about the Bring Back Louisiana campaign is that it marries those type of vaccine events with the door-to-door outreach, with the canvassing outreach that precedes that. So the lessons taken back from the first round of pilots is that it works. It's effective. It's not as fast as I think people would have wished, and it's not as fast as a high-throughput, mass vaccination site, but it is effective, and that's really going to be where the opportunity is going forward. I think if you watch what's happening across the country, states are slowly coming to that realization that after you get through this phase where we've had open eligibility for over a month now in Louisiana, you have to get through that phase where people that were really motivated to do it themselves have done so. It then becomes a more deliberate and intentional process. And that's where we are right now. Yes, sir.
On a daily basis, are y'all seeing the amount of people getting vaccinated go down significantly?
Yeah, it has slowed. Yeah, no question about that. And part of that is, moving from this open eligibility, great, everyone who's motivated goes and gets it, to, like we just talked about, kind of a more thoughtful, a more on the ground phase where really the opportunity is reaching people in neighborhoods, talking to individuals, having questions asked and answered, which just takes a little bit more time. Yeah. Yes, sir. Last question.
So you mentioned that Louisiana uses about like 80% of the vaccines that are allocated to them. Do you know where that ranks Louisiana among some others, among some of the other states? And do you feel like that shows that there's more vaccine hesitancy in this state than others, or?
I don't know. I mean, it's a movable target. I don't have the actual ranking offhand right now. 81.8% is the number. 81.8% of every dose made available to Louisiana has been ordered and brought in to Louisiana. I think it's a movable target. I still remain very optimistic. I just recognize that this next phase is going to require more work, and it's going to be a more intentional, deliberate phase. Great. Thank you.
Thank you, Dr. Kenner. And I can't help but think that when you were in medical school, you probably thought you just needed to learn all that so that you would know it, not that you'd have to be able to talk about it so that people can understand, but you do a great job, and I appreciate the work that you do on behalf of the state of Louisiana. Look, we can parse it if we want to. The fact of the matter is we have more hesitancy than we want, and it's taking longer to get people vaccinated than we would like. We knew this day would come, and we were hoping, quite frankly, that it would come after more people had availed themselves of these 3 safe and effective vaccines very quickly. I don't know that our experience here is markedly different than many other states, especially in our region. But what I want to assure everyone, there is a vaccine dose for you right now at more than 1,500 locations across the state of Louisiana. And we encourage you to take advantage of that. And we know also that in addition to the efforts that Dr. Kenner talked about, one of the keys to our success is going to be making sure that primary care physicians have the opportunity to vaccinate their patients when they come in for a visit for another reason, and they have an opportunity to have that face-to-face discussion. But this gets to the larger point that he was trying to make. That is not a high throughput, very quick way to get to the numbers that we need, but it's an essential way, and it's just going to take longer. But it's something that we're going to have to do in addition to enhanced community outreach with more door-to-door efforts and making sure that we are sending mail and text messages and phone calls, and that we have a coordinated media campaign and so forth. The simple fact of the matter is that if I or Dr. Kenner were going to be able to convince someone to be vaccinated who hasn't yet been vaccinated, that would have already happened. It shouldn't be this hard, but it is, and so we're not going to give up, and eventually we're going to get to where we need to be because it's incredibly important. Turning to the legislative session, I'm very happy that a number of my legislative package bills were able to get passed this week in committee. House Bill 379 by Representative Larverdane, which creates a cause of action for sexual harassment victims in the workplace. Senate Bill 105 by Senator Boudreaux, which creates the African American Veterans Monument in Veterans Park. House Bill 446 by Representative Butler establishes an Office of the Americans with Disabilities Act coordinator within the Division of Administration. And Senate Bill 151 by Senator Barrow, which enacts the Foster Youth Bill of Rights. And I want to thank the former foster youth who came together to write the bill, who testified in committee today for their work on this thoughtful legislation. Unfortunately, one of my bills did not make it out of the Senate Insurance Committee, and that was SB 55 by Senator Luno, which would have prevented discrimination in auto premiums based on things that have absolutely nothing to do with one's driving record. So unfortunately, insurance companies in Louisiana are going to continue to be able to set rates in a discriminatory fashion based on gender, marital status, and credit score. Now, why someone's credit score counts for more in setting premiums than their driving record, I will never understand. But it is a fact in Louisiana that poor people with a perfect driving record will pay more for auto insurance than rich people with a poor driving record. Finally, I want to encourage everyone out there, in addition to getting your vaccine if you haven't done so, please donate blood. Make an appointment. The national blood supply is dwindling. Louisiana's needs have also been greatly affected. I think this is in part due to the return of more elective surgeries that were put off during COVID, but what we know is we need people to donate blood. I believe that our needs are only going to increase going forward. So please visit givebloodinlouisiana.org. That's givebloodinlouisiana.org to find a location near you. Tomorrow is the National Day of Prayer, but prayer is a good idea every day. And so I'm encouraging everyone to lift up our state, our country in prayer so that together we will end this pandemic and that we will confront all of our other challenges as well. With that, I will take questions. Yes, sir.
Do you think that the current oversight framework for the Mississippi River pilots is sufficient, or would you be supportive of some reforms in that regard, like some of the legislation that's been proposed?
Yeah, so I do think the current system is sufficient. If the legislature believes that changes are in order, I'll be happy to receive a bill from them and take a look at it and see what that looks like at the end of the day. The bill as it stands today is markedly different than the one that was introduced. It was amended in a pretty robust fashion, and it hadn't come out of the House of Representatives yet where it was introduced. And so, as I always do, I reserve the right to look at the legislation as it comes to my desk, if it comes to my desk, and make a decision from there. Yes?
What do you think about President Biden setting the goal of July 4th to get about 70% of adult Americans their first dose? Do you think that's possible?
Well, it's certainly possible. I think the incremental increase is 160 or 170 million more doses by then. If you look at what has happened over the past 100 days, for example, it certainly should be possible. It just depends on the degree of hesitancy that is encountered between now and then. And we've been talking about hesitancy here in Louisiana, but it's happening everywhere in the country to one degree or another. So I think it's a doable, but it's a goal, and I think it's necessary. But it's always good to be ambitious and to set your targets in an ambitious way. But it would be great to have that, because we were just talking about Mother's Day. But wouldn't it be wonderful if come the 4th of July, more people could get together, especially outdoors, unmasked and close together or whatever, and enjoy their hot dogs and watermelon and fireworks, whatever it is that you do on the 4th of July to celebrate our nation's independence. And so the more people who will be vaccinated between now and then, the better. What I can tell you is there will be ample opportunities for Americans to be vaccinated to reach that goal, both because of the number of providers, the amount of doses that are going to be readily available, the number of safe and effective vaccines that are going to be authorized. We believe by then it'll be down to age 12 and above, at least for the Pfizer vaccine. So yeah, I think it's doable, and I think it's important, but it's important every day that people get vaccinated. And I wouldn't want anybody thinking, okay, I'll wait till July the 3rd. Let's go ahead and do that as soon as we possibly can. Yes.
There have any concerns with Biden's announcement that they're going to steer vaccines away from states that don't use their full, allotment?
No, I don't have any concerns about that, because if we wanted to, we could order our full allotment every week and we could just stockpile it. That doesn't make sense to me, because that vaccination is not doing any good on a shelf in a refrigerator or a freezer. But the nature of a pandemic is such that we want everybody to be vaccinated as soon as they are willing to do so, regardless of where they live in our country. And I have no doubt that the vaccines that we are ordering and that we have on hand are more than sufficient to meet our need. Nothing would make me happier than next week to find out that demand has increased and we need to start ordering our full allocation. And if we need to do that, we will. But we will not have anybody miss a first dose that they want or a second dose that they need to have completed the cycle because of this new policy. But the new policy will allow more people who are wanting to be vaccinated in states that still have demand that exceeds their allocation to be vaccinated. So that is not a concern for me. Yes?
How confident are you that Louisiana could reach some sort of herd immunity? Some experts have said that's a unattainable goal at this point, or unlikely goal at this point. And in your mind, when does the pandemic end, or when does the vaccine rollout end if it becomes increasingly hard to get people vaccinated?
It's a difficult question to answer. This was part of the discussion on our call this week on Tuesday morning, the national governors calling with the White House folks on the with respect to the coronavirus, and this was Dr. Fauci's presentation. The fact of the matter is, we don't know for certain what percentage of people have to be vaccinated in order to get to herd immunity. And herd immunity generally consists of that percentage of people who have to have immunity to the virus that can be conferred upon them either by virtue of the vaccination or by virtue of having had COVID and that natural immune response that you get. The issue there, for some people, that natural response is going to last 3 months. It may last 6. It may last a little longer. It appears to be a more robust and longer lasting response from the vaccine. But you put the people who are vaccinated together with the people who still have antibodies from the immune response produced because they had the disease, and together that percentage has to be sufficient in order to have the transmission go down to a point where this so-called herd immunity is reached. We don't really know what that percentage is, but what we know is the more people who get vaccinated, which is really what's under our control, collective control. It's not under the governor's control. It's not under the White House's control. It's collectively Americans, Louisianans have control of that. If they will access one of these three and safe and effective vaccines, then we're going to get to that point sooner than later. And then within herd immunity, it is also important that the people, and I mentioned this earlier, who are most vulnerable to the disease by virtue of their age or comorbid health condition, or that they have the vaccine so that we minimize the number of people who have a really difficult course of the disease that might require hospitalization or result in death. All of those things are really important. And then, I see, scientists and doctors who are very well renowned have different ideas about what we can expect from this pandemic going forward. But they all acknowledge that the sooner people get vaccinated in large numbers, the better off that we're all going to be. One more question, if you got it? I guess not. Well, thank you all. I believe our press conference next week will be held, we don't know yet? Okay. Potentially on Thursday, and we will certainly let you all know. Thank you for continuing to cover this. I want to wish everyone out there a happy Mother's Day, especially the mothers across the state of Louisiana. I do want to remind everybody what happened at Christmas. when families gathered, too many of them, inside, too close together, not masking, and at that time they weren't vaccinated. Yesterday we announced 997 cases of COVID. Today was about half that number, but there's a lot of COVID out there in Louisiana. If you insist on gathering for Mother's Day the way you did for Christmas, and you're not vaccinated, and you're not masked, and you're not distanced, and you're not outdoors, you can expect the same thing to happen in your family, and certainly it's going to happen in other families across the state. And so let's learn from the past. Let's do better, and let's get vaccinated as soon as we can. Thank you all, and God bless.
Pomegranates, but no one can figure out how to open them.
You ran out of fruit, didn't you?
No, that's ridiculous. We have plenty of fruit right over here. He's upset because there's nowhere to put all the fruit.
You don't like when they add sugar to the juice. Don't add sugar to the truth.
We're running a bit low.
I just wish I could have shown you my world. It was fruit-tastic.
Don't you talk like that.